James and Laura from Methley. How does it feel for me? May 2023. What health professionals have you had contact with in the last month?
So over this last month, James has had lots of contact. We've been to see specialists in Sheffield and lots of different people in Wakefield, and then also his jaw surgeon in Leeds as well as his cardiac team.
Could you give an example of what worked well?
What's worked well has me being able to get in touch with James's jaw surgeon via the secretary to push when he's going to have his jaw up, and for her to phone me back quickly so that they're keeping me in the loop as to what's happening. And also the scheduling team at Leeds that schedule all the operations are really good at keeping me in the loop as to what's happening and when. So James has learned the appointments that are going to be easy and the appointments that are going to sort of cause him pain or be a little bit uncomfortable for him. So the appointments such as his heart scan, he's really chilled out with them. He's really calm and they'll let them do whatever they need to do. But as soon as anybody puts on the gloves or comes to do a blood test or something, then he does get quite upset. But they are really good at taking it at his pace and making sure we're not rushed and listening to what I say. So James struggles to get any blood taken from his hands. So sometimes I have to go sort of on the side of his arm and things like that. So the people that are doing those things listen to me and try those spots first rather than just trying his hands and realising that I was right. Now that it's getting back to sort of pre-COVID feel in sort of hospitals, so I've noticed that they've got toys out now in the children's departments so that when children are going to appointments, there's things to take their mind off why they're there. And you're not so have to sit still and avoid everybody. So it does have a more of a relaxed atmosphere. I think the appointments that have been offered have really met our needs, and they've also let me change it if I felt like he needed a face-to-face. They've, listened, and then I've been able to change it to a face-to-face appointment. Yeah, so that's Leeds, Sheffield and Wakefield all sort of let me adjust the appointments depending on what I feel James's needs are.
Did you feel James's care was well coordinated?
I think the thing that sort of hasn't worked so well is that it is down to me to pull it all together. So because James sees people across different regions, and over the next few months he's going to have lots of different things happening, it's down to me to tell people in Leeds what's happening and then tell people in Sheffield and then tell the team in Wakefield, so that it doesn't all clash.
How have James's multiple health appointments impacted on the family?
In the next coming few months, I think it's going to be really busy with appointments and operations and in-hospital stays. So I know my daughter's really, really struggling with that, but she doesn't outwardly show it. She doesn't sort of lash out and things like that. She's just really quiet and really sad. So I am struggling trying to get the right support for her, because if you ask her if she's okay, she always says yes. But then she's not, because she's asking me about what's going to happen if James's operation goes wrong. And because she's 10, she understands what can go wrong. So, that's quite hard for me as a mum to answer those questions.
If you could have changed one thing to make your experience better this month, what would it be?
I think the thing that sort of makes any appointments easier is trying to find somewhere to park. So actually physically get into the hospital, not sort of having to leave like an hour before your appointment so that you can think, right, well, if we can't park, we need to find a car park and then walk. So yeah, just more sort of accessible parking, because it does add on a lot to either side of the appointment.
What things about James's care did you really value this month?
So the thing about James's care that I really, really value this month is that when we've been talking about his jaw operation, his surgeon has come up with lots of different plans to try and make sure that it's going to work this time, and has explained the reasoning behind it. And yeah, that has just filled us with like confidence that there's chance it's going to work. James had a cardiac scan, and the doctor that we see when he goes for the scans always takes her time to ask how I am, how are things at home, how's my daughter coping with things, is there any other support that we feel we need, so that they can refer on to different services, which is really nice to know someone else has got us back.
Thank you to Laura for sharing her and James's story.
Produced by Healthwatch Leeds in collaboration with Axinia Yakovleva and Rolara.